Hello, my name is Anne-Marie Leifer, nurse practitioner student at Sage Graduate College. Today we will discuss the website spineuniverse.com. This was referred to me during my recent clinical rotation at a local pain clinic. Utilizing the Accessible Health Information Technology Limited Literacy Populations Checklist, we will discuss how user-friendly this website is for patients. We begin our journey of the website by going down to the site Local Back Pain. Here on the Low Pain Center site, we see that words are short, simple, and easy to understand. Unavoidable terms are explained here by using parentheses. Other areas on the site also use hyperlinks. Sentences are short, and according to the Kincaid reading level, this is about a 6.3 reading level and has a reading ease of 75.4. Next, we will explore the anatomy portion of this page. On this page, we see that the writer uses an active voice by saying, as you can see from the image below, your back or spine is made up of many parts. The pictures are very easy to understand and the labeling is very clear. Under the sign and symptoms portion, clicked right here, we can see that the author assumes little or no background knowledge about back pain. The author even differentiates between acute and chronic pain. Next, under the causes portion, we see that there's a limited number of messages delivered under each portion. The author differentiates between each cause, such as aging, daily life, obesity, and even injuries and accidents, bulleting each statement with little knowledge about back pain. A reader can easily understand what the author is trying to explain. Next, we'll explore what is back pain. Here, the author doesn't use percentages, and makes it easy for the reader to understand by, instead of saying a percentage, he says about 3 in 4 adults. This makes it easier for readers of all reading levels. By returning back to the anatomy portion, we see that graphics are easy to understand and clearly labeled. I would have liked a better picture here, more clearly coordinating with the different sections of the spine, such as cervical, thoracic, or lumbar. However, by scrolling down to the bottom of the page, you can see that there are videos here, and underneath spinal anatomy here, there's a great video about spinal anatomy animation. Here are the videos discussing about the different portions of the back. And here it explains the different classifications of the back. The video goes on to discuss how electrical impulses are sent down the spinal cord and elicit movement and pain. Unfortunately, with Screencast-O-Matic, I'm not sure if the audio of this video was able to be heard, but it is able to be heard on the website. By returning back to the back pain portion and clicking on symptoms, we see here that there is a fair amount of white space. It becomes a little wordy at times, but I do like how each section here is broken up and bulleted into easy reading points. Again, by returning back to causes, we see that similar information is grouped into subsections or chunks. So back again, we see by aging, daily life, injuries, things that can cause back pain. Next, we're going to look at common back pain questions. Here we see that the question and answer section is pretty user-friendly, and there's dark light text on the background, and the font is used consistently throughout with appropriate font sizing and upper and lower case lettering. Everything is justified to the left-hand portion side of the page. Next, by looking at the diverse racial and ethnic groups, this page does not really address that. There is, however, under resources, an option to have the spineuniverse website translated into Spanish. What this page really does is group information by what patients are experiencing, not necessarily by race or ethnicity. What I mean by this is by clicking on Community Advice, there are options on this website by exploring what the patient is feeling. So spinal stenosis, neck pain, herniated discs. This is what the website explores as far as groups or patients feeling similar symptoms. There is not any reference on ethnicity or race. Next, we are going to explore if the content on this website has undergone iterative testing and revision. So by scrolling down to the very bottom of the page, we're going to click on the About Us portion here. In the About Us section of the page, the website does an excellent job of discussing how information is edited and improved for going onto the website. Here it discusses what makes up the editorial board, which is considering more of 90 of the world's leading spine experts. Physicians, doctors, nurses, all sit on this editorial board. Here, by clicking on the editorial board link, there's even a picture with links on each person of the board. By clicking on the editorial guidelines link, we see what the mission statement of this website is. The editorial content is generated by medical professionals and writers who review it for quality and accuracy. They ensure that the message is clear in a manner that is appropriate for the audience and presents up-to-date information, including research, news, and recent developments. What I especially like about this website is that here, under sponsor and third-party funding content, the website does an excellent job by explaining what is the difference between the information that the authors of the website are putting on the website versus what is funded information by medical companies or surgical teams offering treatments. It makes it very easy for a patient to read this website and know what is trusted, reliable information versus what is an advertisement. And down here on the bottom, we see that the website, although it has not been accredited, it is in the process of getting accredited from the URAC. The URAC is a nonprofit independent credit agency that recognizes websites discussing healthcare information. Next, we're going to return to the home page, which is always easy to find by clicking in the left corner on the logo. Here we see that the website runs pretty quickly with flashware, and every page loads quickly with not too big of a graphic on each page. We see the information is prioritized to the top left corner, and then down here is where you see all the ads. What I would have liked to have seen as a little area of improvement for this page is maybe seeing that this portion here being a little bit bigger font. It is a little difficult to see as a priority on this page concerning with all of the ads here. But easily you can go under any condition and easy to find anything that the patient is looking for, as well as treatments and options for wellness. We'll continue our journey on this page by clicking on back pain. Here we see that information is prioritized. The main points are at the top of the page, and information mostly can be seen without scrolling. Again, there's some nice helpful videos, and then all of the third-party endorsed information is down here at the bottom, so I do like that. There's minimal text on each screen, and there is an option here to enlarge the font if necessary. There is no voice-to-text technology. However, by going back to the home page and going under resources, there is a good extensive video directory which offers lots of videos explaining anatomy and different treatment options. Next, we'll explore the treatments page. Here under pain management, we are going to explore the spinal cord stimulator. This portion of the web page I was very disappointed with. The biggest thing is that there's no image of what a spinal cord stimulator looks like. Here the words become very clustered. There's information is not bulleted easily to read, and the reading level of this page jumps from a 6.3 to a 13. The flesh reading ease also drops from a 70 to a 37%. There are videos on alternative treatments, but there's no video about what a spinal cord stimulator is, where it's implanted, anything that would have been helpful for the patient. I was very disappointed with this page on the website. Other than this page, I think this website is very easy to use and user-friendly. All of the headings are logical with text organized under each heading, as seen here. Main choices are placed in a linear menu, limited number of navigation choices, and sections are appropriately named. And as always, at each page, the home page logo is here in the top left corner. Texting is placed in the window neatly, and most of the top prioritized information is at the top without too much scrolling. Next, we are exploring a radiofrequency rhizotomy, which is another treatment option given at the clinic that I'm doing rotation at. And there is an image of anatomy, but again, no image of what a rhizotomy is or what it looks like or what is used for the procedure. There are hyperlinks here that go into further explanation of each term, and it is easy to understand or see what each hyperlink is. At the top of each page, there is an option to print or email any of the information provided. And the site map is always at the bottom of each page here. And there is easy to find contact information about Spineware, and here under Contact Us. Next, we are going to explore the search portion of the page. So here we're going to go into the search and start typing in a search query. I'm going to type in herniated disc, but I'm going to spell it wrong on purpose. And here we see that the computer does, or the website does offer a spelling correction, which I do like. And your top search results are easy to understand. What is a herniated disc? So I do like the search portion of the page. Returning back to the home page, I would like to touch on one last portion of this website. Recently, there was a lot of question and concern about patients getting meningitis from spinal injections. So I do like at the front portion of this page here, any patient that was using this website to find information about meningitis could easily find it by clicking here. By clicking that meningitis link, it brings you down to an explanation of what is going on with the CDC and the investigation of the recent outbreak of meningitis linked to steroid injections in the spine. Overall, I think that this is an excellent website that is easy to navigate and the information is trusted and peer-reviewed. I would recommend this website for patients who are trying to find information about spine conditions, treatments, and general information. The last part I will close with is that there is a link here for professionals, which offers case studies, continuing education, literature review, as well as news and resources. There is even surgical videos of live spine surgeries from leading medical institutions. I also like that the website offers MRI and CT scans of spines with each case study for physicians or mid-level providers who are working with spine patients. Thank you very much for taking the time to explore Spine Universe with me. I would like to thank Amy Eldridge, nurse practitioner, for referring this site to me. Thank you very much, and have a great day.